close to 1 in 5 people in the state of California now do not have any type of health insurance, and that number is growing. And when people don't have health insurance, that creates many serious issues. First of all, lots of people don't get the medical attention they need, and second of all, they end up in places here, like in the emergency room, when their medical conditions are extreme and need emergency attention. It does cost up to 5 times more to treat someone in an ER than in a clinic or in a doctor's office. So it's very important that we address the issue of getting people more insurance. In the month of January, 80,000 people alone in the state of California lost their jobs. Now, the way it works with health insurance, lots of people get their health insurance through their employers. So when people become uninsured, this impacts their entire family. That's why at the Department of Insurance, we've partnered with a nonprofit organization, the Foundation for Healthcare Education. This nonprofit organization has a fantastic website and hotline to help people who've lost their insurance find insurance. And there's all kinds of options, and through the government providing various options, as well as many options through the private sector. And this outstanding nonprofit organization has helped thousands of people every month find health insurance here in California and around the country. So it's my pleasure right now to introduce you to the head of this foundation. One of the main reasons why we're having this press conference today is to make sure that people in the state of California know about the kind of help they can get from this Foundation for Healthcare Education. The founder, Phil Leppertz. Phil?
Thanks, Steve. Appreciate it. Hello. I'm the founding director of the Foundation for Health Coverage Education. And the reason I started this is because people didn't understand all of the different programs that we have in the United States to help cover people who are in all kinds of different situations. For instance, in California and across the whole United States, any small group that has 2 or more employees has guaranteed insurance. They can't be turned down no matter how sick they are. They can't jack their rates up. They can only charge a little bit more if someone's really sick. And people don't know this, so they start to lose their hope towards getting coverage. When I started looking at the whole picture, I had to bring in all of the different public programs. And so, you know, the state of California starts a program, and then 5 years later they do another one and another one. And before you know it, it gets kind of lost. If you look at the uninsured numbers in California, there's usually about 44 million, about 6.7 million people in California that are uninsured. Fully a third of the uninsured are eligible for publicly sponsored programs, don't know they exist, and are not signed up. In many cases, they're free, and in many cases, they're highly subsidized. And we're lucky here today to have someone who we helped, Mr. Cedric Nelson, who found out that even though he was laid off, he could find coverage for his children, and he'll talk about that in a minute. We created some tools called the Healthcare Option Matrix, which breaks down how to get coverage in California. It helps people navigate the system. If they go online, you answer 5 questions. It's anonymous, and it tells you what you're eligible for anywhere in the United States. And we have the entire United States healthcare system online. Every public program for every state. We also have the applications for every plan and the eligibility requirements so people can understand how to get covered for the very first time. So to give you an idea, some of the companies that we're partnering with and nonprofits are the American Cancer Society, which gets 1.2 million calls a year. And anybody who calls, and we actually went to there and listened to the phone calls of these people that just found out they have cancer and they don't have coverage. And the American Cancer Society is referring all of their people who call them that are uninsured to the foundation. WellPoint, and a lot of the other, that's Blue Cross of California and Anthem Blue Cross, and a lot of the other large insurance companies in the United States. If someone applies for an individual plan and gets denied insurance, that's where we can find the people who are uninsured. So all of those companies are now referring to this centralized location for the whole country, anybody who doesn't have insurance, and they're being able to find coverage for the very first time. We're really happy to report that Catholic Healthcare West, which is a very large chain of hospitals in California, 37 hospitals, 43 hospitals nationwide, when someone comes into their emergency room, another spot where you'd find people without insurance, they're referring them to the Foundation for Health Coverage Education, and we found another place where we can help the people help themselves find coverage, right? We don't sell anything, we're just providing all the service and organizing all the information. But the beauty of it is it's only 5 simple questions that you do online, or if someone calls the 800 number, 1-800-234-1317, they'll have a live operator, a real person answer in Fresno, and they'll ask them the same questions and they'll tell them what they're eligible for.
My name is Cedric Nelson. I was employed with Southern California Edison, and after losing my job in October, you know, I was really concerned about health care and how it's going to not only cover myself but my children as well. And I remember going online, and my mother called me and she asked me had I gotten any health care for my children. And I told her, you know, I haven't, and I don't know what I'm going to do about it. She said, stop what you're doing. She says, I need you to go to this website right now. And that's exactly what I did. I hit the contact information. I called. The staff there was very friendly. I answered a few questions, and within just a matter of days, I was able to get my children health care coverage as well as myself. So this really works, and it's a heaven sent for me. It's a load off of my mind, and definitely something that I would like other people to take advantage of as well. My mother got the information from a public service announcement, and you know, I listened to her and I followed up on it, and here I am today.
The website is coverageforall.org. It's all one word. And the 800 number that anyone can call, it's free from anywhere in the United States, is 1-800-234-1317. And this is a really beautiful thing that's happening, because it's the centralization of all of the information for all of the health care for individuals in the whole United States, one place, and people are using it and it's working. Thank you.
Very good. And Department of Insurance contact information, questions about your insurance, complaints about insurance companies, or questions about any of this, contact us on our hotline, 1-800-927-HELP, or online at insurance.ca.gov.